The superficial lymphatics drain the skin over the breast except for the nipple and areola. The lymphatics pass radially to the surrounding lymph nodes: axillary, internal mammary, supraclavicular, and cephalic. The deep lymphatics drain the parenchyma of the breast. They also drain the nipple and areola. About 75% of the lymph from the breast drains into the axillary nodes, 20% into the internal mammary nodes, and 5% into the posterior intercostal nodes. Among the axillary nodes, the lymphatics end mostly in the anterior group, closely related to the axillary tail, and partly in the posterior and apical groups. Lymph from the anterior and posterior groups passes to the central and lateral groups, and through them to the apical group. Finally, it reaches the supraclavicular nodes. The internal mammary nodes drain the lymph not only from the inner half of the breast, but from the outer half as well. A plexus of lymph vessels is present deep to the areola. This is the subareolar plexus of Sappi. Subareolar plexus and most of lymph from the breast drains into the anterior or pectoral group of lymph nodes. The lymphatics from the deep surface of the breast pass through the pectoralis major muscle and the clavipectoral fascia to reach the apical nodes, and also to the internal mammary nodes. Lymphatics from the lower and inner quadrants of the breast may communicate with the subdiaphragmatic and subperitoneal lymph plexuses after crossing the costal margin and then piercing the anterior abdominal wall through the upper part of the linea alba.